Have you ever pondered the nature of devitalized wound tissue and its impact on the healing process? It's a subject that often goes unnoticed but plays a crucial role in our body's recovery from injuries. Devitalized tissue, also known as necrotic tissue, is dead or damaged tissue in and around a wound. This tissue has lost its vitality, hence the term devitalized, due to a lack of blood supply, resulting from injury or disease. It's often characterized by a change in color to black, brown, or yellow, and can be either firm or soft to the touch. Now, one might wonder why it's essential to discuss something that's already dead or damaged. Here's the catch. This devitalized tissue can pose a significant obstacle to wound healing. It acts as a physical barrier, preventing the formation of new healthy tissue. Moreover, it provides an optimal environment for bacterial growth, increasing the risk of infection. But that's not all. Devitalized tissue also promotes inflammation, prolonging the healing process. Therefore, it's not an exaggeration to say that a wound burdened with devitalized tissue is like a car stuck in mud. Without removing the obstruction, it's going nowhere. So, what does this mean for wound treatment? The presence of devitalized tissue calls for a therapeutic approach known as debridement. Debridement is the removal of dead, damaged, or infected tissue to improve the healing potential of the remaining healthy tissue. The method used for debridement can vary depending on the wound type, the amount of devitalized tissue, and the overall health of the individual. Some of the common techniques include surgical, mechanical, autolytic, and enzymatic debridement. The question then arises, will a wound heal with devitalized tissue? The straightforward answer is no, it won't, at least not effectively or efficiently. The presence of devitalized tissue impedes the healing process, and if untreated, may lead to complications such as infection or even sepsis, a life-threatening condition. Therefore, prompt and appropriate treatment is crucial to ensure the best possible outcomes. To recap, devitalized wound tissue is dead or damaged tissue that acts as a physical barrier to wound healing. It harbors bacteria, promotes inflammation, and prolongs the healing process. The presence of devitalized tissue necessitates debridement, a therapeutic approach aimed at removing the dead or damaged tissue to enhance wound healing. And as for the question of whether a wound will heal with devitalized tissue, it's a resounding no. So, the next time you come across a wound, remember that what lies beneath the surface, the devitalized tissue, plays a significant role in the healing journey. It's not just about putting a band-aid on, it's about understanding the process, knowing the obstacles, and taking appropriate action. After all, knowledge is the first step towards healing.